The idea of team compass and culture is you start with culture. Culture is really critical to teamwork because we're changing the way that people are going to be working together. The old model is that the physician or the provider really runs the show and tells everybody what to do. And unfortunately for the physician, that means that they have a huge backpack of work to do. So the idea is that you're bringing these folks together who have really been far apart before into a team to take care of a specific panel of patients. And in order to do that, they need more time than just a 15-minute huddle once or twice a day. So the idea of Team Compass is to give people time away from patients to sit around a table for an hour to an hour and a half of time to talk about what their data shows, to talk about what their goals are, to talk about how communication is and how they are all speaking with one another and working together as part of a team. We need to do a better job and work in a different way in order to provide that care. And yes, it's going to be scary. And that's why culture and teamwork is so important, because you need your team to work through these things and have a support network and work together. Healthcare needs to go a different way. We can't keep practicing in this model in order to really move ahead with where we need to go to take care of every level of patient. I would say that the expectations on physicians and primary care providers in the future are going to be enormous. We are going to have millions of people coming into the system who need primary care providers. There's already a shortage, and you just don't have the time to do all that extra work. And plus, if you went to school to be a physician, we want you to do that work that you were trained to do. You shouldn't have to send out normal lab letters. You shouldn't have to do that paperwork that someone else is very happy to help you with. The individuals participating in a compass are the team. It's the people who sit at a particular station. Everybody who is part of that team attends the meeting. Team compass and culture is critical because you need to really level the playing field. The idea of hierarchy is really going out the window with CMI. Everybody is equal in the organization. Everybody's equal in the team. Everybody's role is important in focusing on the patient and really providing the very best care and meeting the patient's needs. Culture eats strategy for lunch. That's what the saying is. And you can try and implement strategies. From the readings that we've done, the majority of change efforts, I think it's about 70%, fail simply because the culture was either not where it needed to be or they ignored it. The people who are doing the work are the ones who need to be the most involved. They are the ones who need to understand what the goals are and how they're going to get there. And you need to give them the opportunity to step up and to really shine and to work with their partners and show how great they can be. The first couple of months, we ask that you meet monthly for 60 to 90 minutes because it's an opportunity to get away. So it's time out of the schedule where people can get together and meet. So that's what it looks like initially is you're getting this group of people together, the team together, and they're sitting away from their desks, away from the phones, away from computers, and they're just looking at each other and they're talking together. And yet we ask that you have data. As an administrator, you provide them with data. So what are their monthly quality graphs? What are their weekly metrics? What are their phone metrics? What are their patient satisfaction rates? And give them the opportunity to talk about them. And as an administrator, your role is to facilitate the conversation, not to solve problems. They need to solve their own problems. You're simply there to remove barriers. And oftentimes it starts out with, it's pretty stiff. You know, people are a little nervous about this whole thing and they're not quite sure what it means. That's why we ask that you give data to start with, because it really generates some conversation. And then they start moving into, well, you know, if the day planner would do this, then we could do this differently. If as an RN, if you would take on this role and then the provider would do this, then you're starting to create more of the culture of teamwork in trying to reach your goals as a team. So I would say initially the best tool that you can use is insights to get started. And then after that, it's really up to you. Insights and quality metrics, quality and process metrics, and then you can go from there. The data shows that actually employee satisfaction goes up. People feel like they're more part of the organization when they're part of a team that listens to them and lets them work to the top of their skill level. And actually, there are articles and studies that show that quality results go up, that patient outcomes improve when they are working with a team that is providing their care.